It's Dr. Robert Brueck coming to you with our basic intro series, if you will, to cosmetic procedures. Again, you can go to my website, Beauty by Brueck. You can call us at 239-244-2329 to schedule a complimentary consultation, or you can actually do it online and schedule it as well. First procedure we're going to talk about today is a facelift neck lift. And what is a facelift? A facelift is a way that we go ahead, rejuvenate the face to make it more youthful, more appealing, younger, and sort of take the tired look out of your face. In addition to the face, we sometimes will do, in conjunction with the face, a neck lift. They're two separate and distinct procedures. Sometimes we do the neck lift in isolation by itself. Sometimes we combine the two. A question that commonly is asked is, when is the ideal time? And I don't think there's any ideal time to do a facelift. Whenever you start to feel looking tired, or I always say to people, you know, you go into the mirror and you start taking your hands and you're kind of pushing your skin back, that might be a good time to start exploring a facelift. I would say some of the new things that have changed in facelifting, the procedure that I do in particular is called a quick lift. And you can go online, you can see some of the examples on my website. The thing that's exciting about this procedure is that you're actually taking the soft tissues and you're anchoring them to a fixed point that is to the bone. And we do the neck, we do a suspension neck lift, platysmoplasty, we anchor it to the bone. So that's an exciting thing. Now, I always tell people when we're talking about facial rejuvenation, we're talking about loose skin, and then we're talking about blemishes in the face, we're talking about brown spots, sun damage, wrinkles. They're sort of complementary. So that's where a consultation comes in handy, because you can tell me what it is you want. The other thing I often tell patients is that it's not a bad idea to come in with an idea of a budget, and then you tell me what it is your desires are, what your budget is, and we work out a game plan that specifically suits your particular needs. So it's important to understand that nowadays in facelifting, a lot of times what we will do, we will also do autologous fat grafting. As many of you know, fillers are very, very popular. People are getting Juvederm, they're getting Restylane, they're getting all these different types of fillers. I personally prefer using your own tissue. So we take a little fat and stem cells from your tummy, and we use that to fulfill and fill in some of the areas of soft tissue that have been lost as a result of aging. Because as we age, we lose volume and our skin thins. So facelifting and neck lifting are done in many cases simultaneously. Again, it depends on what your particular needs are. How do we do a facelift? Well, a facelift is done as an outpatient. It's done under sedation, which means you have an IV and you're back there, you're sleeping, and it's like if you took a nap. You know, sometimes we take a nap and we're in such a deep sleep that we kind of fall asleep, we start drooling out of the corner of our mouth, and we wake up and, you know, we feel refreshed. Well, that's kind of like the way we do a facelift. And again, the time will depend on whether we're doing a facelift and a neck lift together, a facelift alone, or many cases we'll do a facelift, neck lift with eyelid surgery as well. So it just depends on what your particular needs are. After the surgery is performed, you go to the recovery room, and you're in the recovery room for maybe an hour, hour and a half, and then you go home. And when you go home, it's simple. You go to bed, you put your head above your heart, so you can lay in a lounge chair, you can lay on a sofa, you can lay in bed with a pillow or two. Just keep your head above your heart. If we do eyelid surgery at the same time, I then have patients put ice compresses on their eyes. Now, when you go home, you'll have a big head wrap on. This is sort of a protective dressing, so that when you go home, you'll be remembered that you had some surgery done, and so when you sleep at night, you won't injure anything. You come to the office the next morning, and then at that time we take the head wrap off, and the very next day you can shampoo your hair. And what I tell patients to do is to get a baby shampoo. They can blow dry them, and then I give them a chin strap to wear. And then what you'll do is take a dry hand towel, put that under your chin, and put this strap on, and wear it as tightly as you can to minimize swelling and edema. The stitches usually come out 7, 8, 9 days. As far as activity goes, the first 4 days, lay low. So you don't have it done on Friday, and then Saturday wash clothes, vacuum, wash the car, wash windows, things of that sort. From 5 days to 3 or 4 weeks, let comfort be your guide. So if you're doing something and you feel a little uncomfortable, don't do it. Real physical activity, golf, tennis, aerobics, things of that sort, usually will take about 3 to 4 weeks. And after 3 to 4 weeks, then you can maintain and do any type of exercise you want. There are scar creams available if you want to use those to minimize the scarring afterwards. That's perfectly okay. And I think they help. I think it just depends on how far you want to go. A common question people ask, what do I do in preparation for a facelift? Now, all of my patients, we get pre-op clearance from their primary care doctor. This might involve some basic lab work, a recent EKG or chest x-ray if something hasn't been done. So we want to make sure that you're in optimum health when you go ahead and have the facelift neck lift procedure performed. I generally have all of my patients stop all supplements like fish oil, ginkgo biloba, magnesium, calcium, all these things that are extraneous that you don't need to take at least 2 weeks before. And certainly any aspirin, compounds, or medicines that can cause bleeding, such as ibuprofen, things of that sort, we ask you to refrain from. And by all means, no smoking. Smoking is the most detrimental thing to facelifting, tummy tucking, or any kind of lifting. Because when patients smoke, we can't be as aggressive, and in some cases we can't even do the surgery because we're fearful that the wound healing complications are multiplied tenfold, infection and things of that sort. So it really, really is important to motivate yourself to quit smoking and to go ahead and put the cigarettes aside and in preparation of doing the facelifting, because that can be the most devastating thing of all. So again, post-op, it's stitches out 7, 8, 9 days. And it's not really a painful procedure. Now, I give patients pain pills. I sometimes will give them something for nausea if they need it. But most patients, I tell them, just take some extra strength Tylenol. I think that's really all you're going to need as far as facelifting goes. And expect to have some swelling post-op, some edema, and that will vary. Some patients get a little, some people get a lot. Another thing patients will experience is that you can have some tingling and numbness. So these are all part of it. Now, what are potential complications with a facelift? Well, you can have bruising, swelling, infection, bleeding, scarring. Now, I tell my patients this is part of any operation, whether you're having a facelift, it could be a hernia repair, or gallbladder. There are two things unique to facelifting. One is nerve damage, two is skin slough. Now, in the face, we have two types of nerves. We have sensory nerves, which are touch and feel. And many times after facelift, patient will come back and say, well, my left cheek is numb, my right cheek is tingly, and this is all normal. And that recovery can take several days, weeks, or months. So that's not unusual. Now, in 35 years, I've never had a permanent motor nerve injury, but motor nerves are nerves that supply muscles in the face. So when somebody smiles, those are motor nerves. When you raise your forehead, those are motor nerves. Again, I've never had a permanent injury in 35 years, so it's extremely rare. Now, a devastating complication can occur, especially in smokers, and that's skin slough. And what that involves is when people smoke, vessels constrict. Now, when that vessel constricts, it means the blood flow doesn't get to the skin, it can't heal properly. And in some cases can perform and create a huge scab and a tremendous problem as far as skin loss or skin slough. And this can leave horrendous scarring. So it really is prudent and wise to quit smoking 2 weeks before and 2 weeks after your surgery. So facelifting is an exciting thing, and again, I would say probably 80+% of the time we will do a facelift and or neck lift in conjunction with other procedures. Might be autologous fat grafting, it might be peeling, it might be upper and lower lid blepharoplasties, brow lifts, and the like.